There are three key components to the Muir Wood program that I particularly admire. And the first one has to do with their recognition that treating adolescent addiction is different than treating an adult, because the adolescent brain is not the brain of an adult. And so you have to do it differently. So that's number one. The second one is that they understand it takes a long-term approach and a comprehensive approach. Because of the way the adolescent brain develops from 12 to 25, you need to provide them with adventure, and that's one of the things that are provided here at Muir Wood. We also need to help heal the infrastructure of the brain, and that's nutrition and exercise and sleep. And that actually does things in the brain, not only just for the body. And then to provide ways of pushing new synapses, new brain maps around mindfulness practices, as well as dealing with any underlying issues, maybe a mental illness or some sort of trauma. So it's that comprehensive long-term approach, because you see, we give you time for treating cancer or heart disease or diabetes, and for some reason societally we have this perception it should be done in 28 days, but it can't, because it's a brain and it controls everything we think, feel, say, and do. So that's number two. And then the third piece is their family program. The family is deeply affected by this, not only their own emotional and physical health, but just the worry and the angst about their child, and will they make it, and can they stop? And so helping that family is going to help them individually, but also then to support their adolescent in long-term recovery. One of the things that the Muir Wood family program will help parents especially understand is that it's not their fault. That's oftentimes what they think, is there was something they could have done differently that would have made a difference. And so when they understand that there's many factors that go into the developing teen brain, as well as developing addiction, they can appreciate that that brain is the issue. And so when we help heal that brain, that individual will be on a better path. And then we can also help the family member with their own brain health, so that they will have a calmer, healthier, happy life, as well as be able to support their adolescent in a better manner. So the Muir Wood program offers that and requires that the family participate, and that's huge. It is a family disease, and when we can help everybody understand, we eliminate the stigma and the shame and the blame, and we can free ourselves to do what we need to do to heal the brain and live happy lives. When we interrupt addiction early, during adolescence, before we let it progress, we just give them an amazing opportunity on a healthy, happy life.